You've been suffering from foot pain and heard about a treatment called shockwave therapy. You're curious, but you've got questions. What is it? How does it work? Will it hurt? Is it right for you? My name is Dr. Andrew Schneider, a podiatrist based in Houston with over 2 decades of experience. Let's demystify this modern podiatric treatment so you can make an informed decision about your foot health. After all, you're just not stepping into any treatment, you're stepping into the future of foot pain relief. In today's video, we'll discuss what shockwave therapy entails and how to know if it's the right choice for you. But before I do let others know about these videos, please like, comment, hit the subscribe button, and share on social media. This will help others find this information. Looking at the history of extracorporeal shockwave therapy, it's interesting to note how its development has revolutionized foot treatment options. You might be surprised to learn that shockwave therapy was introduced in the 1980s to break up kidney stones. It was only later that practitioners began to see its potential for treating other conditions. By the 1990s, they were using it to heal inflammation of ligaments, tendons, and other soft tissue. But it wasn't until the early 2000s that podiatrists started using the shockwave therapy for foot ailments. They found it was particularly effective for stubborn conditions like plantar fasciitis, and today it's a standard treatment that can offer you significant relief from foot pain. The type of shockwave that I use in my office is called EPAT, Extracorporeal Pulse Activation Technology. It uses focused impulses to stimulate your body's natural healing response. The device projects shockwaves or high-energy sound waves into your damaged tissue. These waves aren't random, they're precisely aimed at the spot that's causing you trouble. The shock waves trigger your body's self-healing ability. They increase blood flow to the area, reducing inflammation and accelerating healing. They also stimulate the production of collagen, a protein vital for tissue repair. And they help dissolve calcium deposits that cause pain. It's not a quick fix, though. You need a few sessions to see results, but many patients report significant improvement in pain and mobility after treatment. Shockwave therapy can treat several tricky foot conditions that you might be dealing with, such as plantar fasciitis and Achilles tendinopathy. So if you're struggling with chronic heel pain, this could be the solution you're looking for. Plantar fasciitis, a condition where inflammation occurs in a thick band of tissue connecting your heel to your toes, responds well to shockwave therapy. Similarly, Achilles tendinopathy, an injury to the Achilles tendon, can also be treated effectively. If you're suffering from chronic plantar fasciitis, it's likely that you're experiencing degenerative changes to your fascia, a problem that EPAT can help address. The degeneration is often the result of continuous strain, leading to inflammation and thickening of the tissue. It's like a worn-out elastic band that's lost its stretch, causing pain and difficulty walking. EPAT uses shockwaves to stimulate your body's natural healing process. The shockwaves cause microtrauma in your affected tissues, which your body responds to by increasing blood flow and metabolism in the area. This speeds up your healing process, reduces inflammation, and ultimately relieves your pain. Multiple studies have confirmed its efficacy. In one study, it was found that 82% of patients experienced a complete resolution of symptoms after EPAT treatment. In another, there was a significant reduction in pain scores after just 3 sessions. You see, EPAT isn't just a temporary fix. It's a solution that offers long-lasting relief. It's non-invasive, safe, and it works. Plus, it has the added benefit of no downtime. You can literally walk out of the clinic and carry on with your day. When you hear the name shockwave therapy, it sounds painful, right? The good news is it's not painful at all. You'll feel a heavy tapping sensation, but nothing that's greater than a 4 or 5 on a scale of 10. Once I identify the focal area of treatment, I'll apply a water-based ultrasound gel and start the treatment. As I raise the pressure of the shockwaves, you'll give me feedback on how you're feeling to ensure the treatment is in the therapeutic range. You might be wondering if shockwave therapy is right for you. It's not a one-size-fits-all solution, but depends on factors such as the duration of your symptoms and any prior treatments that you've tried. Before seeking shockwave therapy for your foot, it's important to consider how long you've been experiencing symptoms. If your foot pain's only been present for a few days, it's likely not the right time to start shockwave therapy. Your body has its own healing mechanisms that kick in when injuries occur. More often than not, these symptoms may resolve on their own with rest, ice, compression, and elevation. However, if you've been dealing with persistent pain, swelling, or other symptoms for several weeks or longer, shockwave therapy could be an effective solution. Chronic conditions that haven't responded to conservative therapy are also good candidates for this treatment. I often get asked if insurance covers shockwave therapy, and unfortunately the answer is no. Insurance typically does not cover treatments considered to be regenerative medicine. Shockwave therapy is worth the investment in your health to allow you to do whatever you wish to do without pain. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you have plantar fasciitis, Achilles tendonitis, a Morton's neuroma, or any other foot pain that you can't get rid of, shockwave therapy may be the treatment you're looking for. Give us a call to schedule an appointment. The link to request an appointment is in the description. Thanks so much for watching, and have a great day.